very good evening to all of you. Hi, I'm Dr. Shiva Prakash, and I'd like to, at the outset, thank Chrome Productions as well as Alliance Francaise for having us over here. I was invited to be a part of this talk, and I really thought that this would be this is rather a very important thing that we need to think about and discuss. So basically what I would like to share from my perspective is more of a mental health perspective of how professionals or caregivers in the medical field would view addiction as. Now, addiction is a term that's thrown around quite a bit, just like many mental health terms, as you know, depression, anxiety, and addiction. And a simple search of the internet would tell you that the most common synonyms that come along with addiction are probably dependence, craving, habit, weakness, compulsion, and fixation. I mean, those are the top few words which come along as synonyms. And we really see that addiction has this huge moral, legal, social baggage that it comes with, especially when we are talking in late terms. And really, as we saw during the course of the presentation, the moment you throw in even a little bit of moral baggage, like the man basically introduced, beat up poor Santosh saying, this is the wrong thing, and don't you know that this is wrong? And the moment that started, you see how Santosh turned off. The same held true even in a much milder form, which I noticed was when one of the interviewers just started asking him about the substance and what he was doing and how, and everybody looks at it with the perspective of, this is something wrong, you get your act together, and we need to move on. And really, that's hugely off-putting. Off-putting in the short run, and definitely not helpful in the long run. So mental health professionals basically figured that looking at it purely from a moral, social, legal perspective wasn't helping. And that's where they expanded the program, and they tried to look at it with a more biological perspective, which is what all medical professionals do. They try to find biological explanations. And so that's where the biopsychosocial model of addiction came up. And the biopsychosocial model basically looks at it from the perspective of these three aspects. There is a biological aspect, there is a psychological aspect, and there is a social aspect. Madam Napine just talked about the psychological aspects and how environment has a huge influence on how addiction happens, how it is perpetuated, how it is maintained, and so on. And hopefully we'll be able to cover a few of the biological aspects during the course of my discussion. So, over the course of time, addiction as a term is used less and less in medical literature, and we've got other terms like abuse and dependence, and right now we are moving towards more of a spectrum problem. Now, what's common? Now, what's common is that certain few characteristics of this problem tend to remain constant, and actually they've been expanding. Until now, there needs to be a substance. The choices of substances have been changing. There have been times when cannabis was used in religious functions here in India, and now at this point of time, cannabis after above a certain amount is considered illegal and is required for treatment. But over the course of time, we have noticed that there are certain behaviors which tend to get included in the spectrum of addiction or addictive behaviors. And the most common of these things we can think of are things like gambling, We can think about internet addiction, pornography addiction. We can think about, even as of now, video game addiction. These are all progressively being expanded to be included into the scope of addiction. It's associated with significant harm. So this is another constant feature. So one, there must be a substance. Next, there should be some sort of a harm associated with it. And we look at harm. There is continued involvement in the substance or the behavior despite harm. And this is important. This particular individual, Santosh, as we saw during the course of this feature presentation, he is picked on by kids. He's beaten up by others. He has to go around hiding his face, wiping his face every now and then just to make sure that nobody else is checking on him, that he's sniffing glue or whatever. In spite of which, he comes back and he continues to do the same behavior. Even the small enticement of 5 rupees or 10 rupees, the money that was being, the carrot that was hanging at the end of that stick, attracted him to come back and re-engage in the behavior just with the hope that he could get some more money to use substances. And finally, what we need to keep in mind is that the activity or the substance is, or at some point of time was, pleasurable or valuable. This is something that we tend to ignore a lot. That for some people it does have value. It may not have the same emotional balance or the emotional value for each and every other individual, but for some individuals it has huge value and it can cause the recurrent use in spite of problems. Now, so as we progressed in time, we've started understanding some of the biology, we've started understanding the biological underpinnings of substance use disorders. And we noticed that it's the same pathway that gives us all the sense of high. For example, any athlete would tell you that the last 100 meters of the race, when they really run fast, no matter what, gives them something known as a runner's high. Any person who's had a 3-course meal with an awesome dessert at the end will tell you that no matter what you've had in the beginning, the dessert always counts for something extra, right? And it's the same system that is being evoked within the brains of every single individual who's using substances. Madam talked about the limbic system, which is part of our emotional system, which basically is one of the systems which is associated with producing this high. And this is the reward dependence that we look for. Now, not only this, we understand also what are the neurochemicals which are involved. We understand that there is a huge amount of genetics. We know that certain individuals are hugely intolerant to alcohol. And it runs in their genes. They are not able to use alcohol the same way as other individuals who tend to get addicted do. They have something known as pathological intoxications. Even small amounts of alcohol cause huge amounts of intoxication. So these are all things which we are learning thanks to this biopsychosocial model that of substance use disorders that we are looking at. We are also, this particular child very beautifully demonstrated one of the features of substance use, which is intoxication. The man went around describing how he was walking in an inebriated state, how he was talking about the kind of high that the child was experiencing and so on. But we need to understand that there are also psychological and social cause and effects which have been discussed, right? So now I'd like to focus on one particular aspect with which I hope we can kind of come to a conclusion, is harm, right? The moment we think of harm we think of financial harm, we think of physical harm, we think of psychological harm, we think of legal harm. Being caught with certain drugs could lead you into jail immediately, right? But in this current scenario of the feature that was shown, we need to acknowledge that there is a harm to the developing brain. We are talking about a harm to the role function of a developing child. We are talking about harm to this particular individual as a child, as a student, as a family member, as a member of his peer group. And during the course of this discussion, this feature, we noticed that almost all aspects of this were affected. That's the kind of harm which would be more, which would be long-standing, which would have huge consequential downstream effects, which we really need to address. Thanks to Ram's presentation, we actually have a longitudinal view. We are noticing that these downstream effects are not affecting just him, but affecting the decisions that affect his siblings and his family. And harm is something that needs to be acknowledged. Harm is something that we need to understand, and hopefully using a developmentally focused, especially when it comes to children, clearly using a developmentally focused biopsychosocial intervention, which may involve a lot of the legal supports that you had mentioned, which seem to be dysfunctional at this point of time. But using these legal supports, using the supports of the family, using the supports of the school, using the support of every single like-minded individual who's sitting over here, trying to gain knowledge and being an advocate is important, right? This multi-pronged approach might actually have a significant impact on the lives of these children and, in essence, the future of our country. So I thank you for your patient listening, and I now invite Madam Padmini to come and finish.